This is Sarnia Lambton Daily for Tuesday, May 19th. Good evening, I'm Terry Doyle. The provincial government has announced the fate of the province's schools for the remainder of the school year.
The safety of our children is my top priority. And one thing I will never do is take unnecessary risk when it comes to our children. And that's why, after careful consideration, after consulting with the health experts, it is clear that we cannot open schools at this time. I'm just not going to risk it. This wasn't an easy decision to make, but it was the right decision. We've made the decision to put our kids' safety first. And at the same time, we have a plan to ensure that our children's education can continue outside of the classroom. At-home learning will continue. All students from grades K to 12 will receive their report cards. We're doing everything possible to make sure our students have the opportunity to graduate this year. And we're working hard to ensure that child care centers will begin to open safely once we get to stage 2 of reopening.
Premier Ford gave me a clear mandate to do whatever it takes to keep students safe. And that is why in this province we closed schools, the first in this country. It is why today, following the advice of the Chief Medical Officer of Health, that public and private schools will remain closed until the end of June. We will act to keep students safe.
Premier Doug Ford also announced that emergency orders would be extended until at least May 29th that force restaurants and bars to close except to provide food for takeout or delivery services. Social gatherings are still limited to 5 people, with outdoor playgrounds, play structures, fitness equipment, and splash pads staying closed. The emergency order also impacts the redeployment of staff for long-term care and retirement homes. The Canada-U.S. border will remain closed for another month. Prime Minister Justin Trudeau announced this morning that an agreement has been reached with the United States to continue border measures through June 21st. This means the Blue Water Bridge will only remain open to truck traffic and essential workers going back and forth. The previous agreement was set to expire on Tuesday. Locally, here are the numbers where we stand in Sarnia Lambton. There have been 225 confirmed cases of COVID-19, with 19 deaths and 163 people recovered. That means there are 43 active cases in the region. It was a rough weekend for retirement and long-term care homes in Sarnia Lambton, with 2 new COVID-19 outbreaks declared in Sarnia. Lambton Public Health declared an outbreak at Village on the St. Clair on Front Street. 2 residents there have tested positive for the virus. An outbreak has also been declared at Marshall Gowland Manor on Devine Street. A resident there has tested positive. During the COVID-19 pandemic, 1 positive test at a home results in an outbreak being declared. Meanwhile, at Vision Nursing Home, 14 residents and 10 staff have now tested positive, with 4 residents passing away. The home has been in an outbreak since April 23rd. Let's check in with Heather Martin, Executive Director and CEO of Vision Nursing Home, joining me now. And Heather, we know it's been a busy time and a stressful time. Just in general, right off the bat, how are you and the staff and everyone doing there right now?
We're maintaining. We're trying to keep our level of sanity in place. It is very challenging, very difficult. It's worrisome. We worry about our residents and our staff and our families. It is a tremendous challenge. Never one that I think anyone, unless you go through this, you have any idea how big it is.
Obviously, this is, the pandemic itself has been going on for a while. As any home, I'm sure you had to be prepared for this. You were prepared for this. What was already going on even before the outbreak to obviously look at limiting the spread?
Well, we had heightened our precautions, our training for staff for protective equipment, the environment. We had stopped all transfer of residents from our home areas into any congregate settings. So we eliminated our socialization immediately to the units. And as much as possible, we stopped any kind of staff crossover. We eliminated any staff working in 2 locations as required by the government. And we started to isolate residents at any immediate onset of a symptom. what we found out is that the initial symptoms as defined for case definition were very minimal, and we followed instructions of public health and the greater guidance of other organizations to come to find out, I think, a little later on that anything became a symptom. So that probably would have been something had we been informed, we may have started precautions sooner. I can't say, in hindsight, you look back, you say, how did we get to where we are? We don't really have a lot of time to do that right now. And that's unfortunate. We can't, we will do a post-mortem, there's no doubt.
Yeah, you're living in the current right now and obviously dealing with it. And it's the big thing right now, once again, just keeping everyone apart as much as possible to minimize any further spread.
Exactly. And when the virus did appear, it was on one unit. We isolated the unit, and then we were further able to isolate that unit into 2 wings, which was good. So we did have it relatively stable down to 1 unit. We are experiencing some crossover, and we're dealing with that on a daily basis, where if we see a resident that is symptoms, obviously they are isolated, but further we have transferred a couple of residents from their home areas into our unit that is COVID positive in order to stop the spread through other areas. And constantly looking at, we have Blue Water Health infection prevention and control team working with us. They've been in and done two audits and 2 walkthroughs, and we're having another one today, taking advantage of their skill set and experience, looking for how this thing is beating us.
And I guess that's the thing is right now working together and knowing, another set of eyes, another set of anything has obviously got to help for what is the big goal here.
Yeah, and they are equally as challenged to find areas where there are opportunities for us to tighten our belt. We're tenacious with trying to beat this thing, and so far we really haven't come up with anything unique that we've missed. I think the distinction between hospital and any long-term care home is that the long-term care homes are truly homes. So when the IPAC teams walk through our building and have a look, and they see all the knickknacks and pictures and gadgets, they see the challenge we're faced with when we encourage our residents to make this their home. So it's not a sterile environment like the hospital. So our challenge is greater in that extent, but it's something that exists in long-term care. It's a home.
How's the staff doing?
Oh, challenged. Challenged. Yeah. Some of our staff have elected several different decisions they have to make. One, working at another employer, possibly having loved ones at home that may be compromised, that they're fearful that they may take the virus home with them if they got it at Vision. Others that have children at home that are not in school, that and the daycares aren't open, and they can't use other people to babysit. So we've been struggling with our staffing for sure, and the struggle will continue until this thing is gone. So again, that's where we've had a wonderful partnership develop with Blue Water Health, that are providing us with staff from the hospital to work at our home. So we're thrilled to bits that we can access that.
And I'm sure the staff that you do have on site right now, just they take an ownership and they take a pride, I'm sure, in their work. And this has got to be an emotional time for them. And I'm sure, all the efforts they put in is certainly appreciated.
And that's true. And, as much as they're courageous, they're battlers, they're fighters, they're going to win this one. It is exhausting. Everybody is contributing, working extra hours and long days, and working to find solutions, and that in itself, while you're in the battle, you've got the energy, and I'm sure that when we stop, that's when it's going to hit.
You mentioned before we came on, obviously one of the challenges, we see what's gone on in other areas of North America and sort of sensationalized a little bit, New York City, for example, what we've seen. Has that been a challenge because people, they hear the word outbreak and they think the absolute worst?
Well, I would never minimize that. There are some places and some homes that have been truly decimated by this terrible disease. And my heart breaks, and I can't watch the news anymore. I'm done. Yeah.
But I guess, and yeah, versus what's going on here, I guess if we can turn a little bit of a positive side, is the fact that everyone has come together. You don't feel like you're on an island because you have Blue Water Health, because you have other resources, I'm thinking, that are willing to step up and help.
Absolutely. And I think the support we're getting from family is absolutely phenomenal. Their words of encouragement, and they're our cheerleaders, and knowing that we're taking care of their loved ones, and they trust us with that, is the most important thing that we can ask for at this time. And I think, fortunately, our community is a wonderful community. Any of the newspaper articles and items that have gone into the papers are truly supportive. And I'm so thankful that we have the respect of the community in this regard. I can't imagine, it's hard enough dealing with this. We don't need to get beat up by others, So yeah, that it's helpful. It's really helpful when we know people are supporting us. So we'll get through it.
Absolutely. Before we let you go, just give us an idea. I understand Vision is sort of broken up into a couple different wings or a couple different areas.
In the nursing home, we have 5 resident home areas. So each of those have full supportive independence. So they would have their own nurses station, dining rooms and living rooms, and maximum of 32 people. So our units range from 26, 28, and 32. So that does help us in isolation. Some of the challenges is getting adequate resources into each of those areas when we're closing the doors and asking the staff not to cross over and to use separate exits, and isolating the housekeeping rooms and the showers, and so it's the small things that really complicate things, but we're getting through that too.
And I guess that's the thing. Finally, you're taking those steps indeed where nurses, I understand, and staff are going out through, exits they wouldn't normally use, they're putting in that extra effort because they care.
That's right. Our fire exits are now our exits out of any of our units, so that you don't come back through the building and go out through the front door where you could possibly touch a doorknob or something. The biggest challenge we have, I would say, is that we have to keep encouraging our staff and the community at large to respect the social distancing. And we've said to staff, if you don't need to go out, go home. Just stay home, because there's no other way that this gets into our building other than by staff members. So that's the best thing we can do: hand washing and staying home.
Well, Heather, we know it's a very busy time. We appreciate you joining us. We certainly pass along our best wishes. We know the staff, residents, everyone, management team is working around the clock to beat this. So we pass along our best wishes to you guys.
I really appreciate it, Terry. Thank you very much, and keep up your good work.
Thanks. That's Heather Martin joining us, the CEO of Vision Nursing Home. Stay tuned. You're watching Sarnia Lambton Daily on your TV. Welcome back to Sarnia Lambton Daily. Well, as we usually do, we check in with various organizations in Sarnia Lambton to see just how they're doing right now. And let's go to Victim Services. Here's Kristen Carter, the Executive Director, joining me now. And Kristen, first of all, give us a little background. How would you describe the services that Victim Services provides?
Hi, thank you. Victim Services is a nonprofit organization that works in cooperation with first responders in Sarnia Lambton and other community agencies. So we are a 24-hour crisis support to victims of crimes as well as tragic circumstance. And so we are a nonprofit with a small team, but we have a strong and mighty volunteer team as well.
Well, Kristen, now that we are here during the pandemic, what are you seeing? What are the challenges faced?
So I think like a lot of organizations, the biggest or the first challenge is just navigating how do we move our services to a virtual format or anything that's not that in-person face-to-face meeting that we're used to doing. So when it became a state of emergency, we moved into our plan, which had staff working remotely, and that was not too bad of a transition, I think, because we are used to working across Lane County at different locations anyway. So we were able to make that transition for staff pretty well. Our volunteers and staff are supporting remotely right now, so that's very different for us.
Is that a little bit of a challenge as well? Because for some people, a victim of a crime where that face-to-face reassurance, that face-to-face, just that someone in their corner, someone working with them, having to do that virtually, is that maybe a little bit more of a challenge to just provide that immediate support?
I think it may be for some, because what we do offer is emotional and practical support. A lot of what we're doing is we're just being that empathetic, non-judgmental, compassionate support. And so for a lot of people following crime or tragedy, it's really comforting to be able to have victim services staff or volunteer there with them present in the moment. So we are missing that, but we are still available 24 hours a day. It looks a little bit different right now, but we're still available to talk by phone or other virtual means as well. And then we do have a few kind of exceptional circumstances where, alongside with our first responder partners, we have been able to go out on scene to support when absolutely needed.
What are you seeing right now? We're into about week 9 roughly of all of this. Has there been, in terms of the levels of service required and the demand for service, what are you finding?
Okay. It's a bit quieter than we're typically used to. And specifically around domestic violence related calls, it is quieter than we're used to having it at this time. And so that's really concerning for us because we know that domestic violence is a crime that persists in our community. And so when we're not hearing from the people affected by that, we're very concerned for them. It may be due to the social distancing or people being home that they're residing with their abusers and it's not safe or doesn't feel safe or feasible to be able to reach out in the same way that they did before. And so we are concerned for those people. We're still here, we're ready. So anybody who's in that position, I would just ask that if they're able to reach out to us by any means. If a phone call doesn't feel safe, they can send us an email or a message on Facebook. And also we're available 24 hours a day, 7 days a week through first responders. And so if somebody's needing to contact police for safety reasons, they can access us through them at that time as well.
And I guess the thing is too, if someone's in that situation thinking, I'm kind of stuck here, no, I'm sure between victim services and your other network of services, there are things for people to assist them.
There are, and this has been a really challenging time for everybody in the community. It's a hard time for organizations, but the Sarnia Lambton community has been so strong in organizations working together and really strong engagement. So Victim Services is an organization that we're there in the immediate following a crisis or tragedy with follow-up. But a lot of what we do is referrals to that best most appropriate long-term support. And so we're still doing that. And there's just been excellent communication among our partners in the community. So we're well aware of what's available, what kind of changes have happened, how to access them. And so we can still help people to navigate that as well.
Many organizations we talk to, it's either current or in the future concerns about fundraising. Where do things stand in terms of victim services for potential challenges there?
Yeah, so we did have a number of events planned for the spring, which like many others have been canceled or postponed, unfortunately. Again, we're a nonprofit organization, even though we do work closely with first responders. They're a referral source, but we're not funded by them. And so fundraising is important for us. And we're a small staff team, and again, we rely really heavily on our strong volunteer team. And so fundraising is also important. And I think as we're kind of adjusting into what our new normal looks like, we're going to have to navigate what fundraising looks like in this new sort of virtual way.
How about things for you, the staff, and you said the volunteers as well, just because sort of it's easier when you see each other in person to lean on each other and support each other and work together when even you and your team are spread out now. How's that been?
It's an adjustment, you know, it's been different. We're used to working very closely, but just because we're apart physically doesn't mean that we don't have that same strong communication. I think the kind of work that we're doing, it's really important for victims, staff and volunteers to stay connected. It's really important for us to be able to support one another. We need to be able to breathe together, and so staff are meeting virtually quite regularly. When volunteers are engaged, we're supporting them throughout. We're talking to them immediately afterwards to debrief and continue to support them. We miss seeing each other face to face and being in a close space, but we know that just to be able to do the work that we do and do it well, we need to stay connected. And so we've made when first to be able to do that through means.
Kristen, before we let you go, just in general, what would be your message Victim Services would have for the community as a whole as we continue to deal with this pandemic?
Our message is that we're here for you. I know that it may feel a little bit scary at these times, and you're not sure of who's available, how to reach them. Please do reach out to us. Again, if a phone call doesn't feel safe, email, Facebook, we're available through those means. We will be here to support you if you need to connect us. That's an option as well. And then for other supports, they may not be a victim of crime or tragic circumstance, but they're needing some help to navigate services in the community. Still reach out to us. So what we do again is referral services. So we have a really strong knowledge of what is available in the community, and we can help make those connections as well.
Well, Kristen, we appreciate the time and all the best to you and your staff. We'll catch up to you again down the road.
Thank you.
There's Kristen Carter, Executive Director of Victim Services of Sarnia Lambton. You're watching Sarnia Lambton Daily on your TV. Welcome back to Sarnia Lambton Daily. Today, the province announced the fate of the school year.
After careful consideration, after consulting with the health experts, it is clear that we cannot open schools at this time. I'm just not going to risk it. This wasn't an easy decision to make, but it was the right decision. We've made the decision to put our kids' safety first. And at the same time, we have a plan to ensure that our children's education can continue outside of the classroom. At-home learning will continue. All students from grades K to 12 will receive their report cards. We're doing everything possible to make sure our students have the opportunity to graduate this year. And we're working hard to ensure that child care centers will begin to open safely once we get to stage 2 of reopening.
Meanwhile, the Canada-U.S. border will remain closed until at least June 21st. Traffic across Blue Water Bridge limited to truck traffic and essential workers. That's going to do it for our show tonight. Thank you so much for joining us. For all of us here at Your TV, I'm Terry Doyle. Have a good evening. We will see you back here tomorrow.